Hello, and welcome to our How to Support a Friend workshop recording. This session is about how to support a friend with poor or declining mental health. We can find ourselves sometimes not asking how people are, through fear of not knowing what to do if they say they're struggling. Or we can go the other way, of getting so involved with trying to help someone that it can have a detrimental impact on our own mental health. Although you are never responsible for someone else's mental health, it can help to feel more confident in how to approach and support someone, while also recognizing the boundaries you should put in place to support yourself as well as your mate who's struggling. The aims of this session are to enable you to explore practical steps to support friends and peers with their mental health, recall the importance of self-care when supporting others, identify ways to maintain or improve your well-being, and to identify the support available at UEA and how to access it. Please note there'll be discussions around self-harm and suicide in this session. Please feel free to pause or stop watching the video at any point if needed. As we go into the content of the session, it's important to clarify some of the language we'll be using. When we talk about mental health, we mean how you think, feel, and act, and how you relate to others. Everyone has mental health, just like everyone has physical health. Mental health is not as simple as the polar opposites of wellness or illness. There's so much in between, and it's something we all live with in every moment of every day. By accepting this, it makes mental health a conversation we're all part of. It can make it easier to check in with our peers and ask if they're okay, and that bit easier to reach out for support when needed too. When we say friend, we mean someone you trust and look out for. But for the purpose of this workshop, we also mean anyone in the UEA community, rather than just being a person close to you. So this could be someone on your course, for example. When considering how to support a friend who is experiencing poor or declining mental health, we've broken it down into 3 simple steps. I'll briefly introduce these now before going into more detail on each section. 1. Notice. What do you see in their behaviour? Are there any changes from the normal behaviour? Is there anything causing you concern? Bring up these observations with the person in a way that is sensitive and kind. 2. Listen. Try to hear what they're saying without making judgments. Give them space to talk about how they feel without giving advice straight away. Allow time for them to feel truly heard. Remember, silence can be supportive. 3. Signpost. Understand there are boundaries to how much you can do, and there's lots of other support available, rather than you taking on all the responsibility for that person. Signposting someone helps them to get to the right support sooner. And finally, look after yourself. This runs across all 3 stages and is the most important part of supporting someone else. You need to be taking care of yourself first before helping others. These steps may seem simple, but human emotions are complicated, so we try to keep the steps simple so in the moment you can really focus on the person in front of you. We'll start with step 1, which is notice. To introduce the concept, we'll use an example of someone on your course who is quiet and withdrawn. Take a moment to pause the video and consider what might be going on for this person. The key point here is we don't actually know, so it's important not to assume and to make sure we ask the person. When thinking about what is going on for someone, it can help to picture an iceberg. The tip of the iceberg is what we see, i.e. quiet and withdrawn. But there's all this stuff under the water that we don't know, which is why it's best not to assume, but instead to ask. I noticed that you seem quiet and withdrawn. Then it's an observation and not a judgment about what might be going on for that person. And it gives them an opportunity and space to talk about how they feel. And even if nothing's wrong, they know you care. Although we don't know what may be going on for someone, there are some signs which can suggest someone's experiencing poor or declining mental health. They could be showing signs of long-lasting sadness or irritability, extremely high or low moods, excessive fear, worry, or anxiety, social withdrawal, dramatic changes in eating or sleeping habits, or any changes to their baseline normal. If you spot any of these signs, it doesn't always mean someone has a mental health issue. Any change in behaviour could mean someone is experiencing difficulties, but it might also not mean that. So again, it's important to ask. And try to do so in a sensitive and kind way. Consider where and when you have this conversation too. And also, if you're asking someone how they are, make sure to ask twice. Often, when asked how we are, we say, "I'm fine." Asking again makes sure the person knows you really do care and want to know how they're feeling. Also, it's okay in that moment if the person doesn't want to talk. Give them the option to speak to you at another time and try to check in with them at another point. Remember, we are noticing and checking in with the person in a way that is non-judgmental and feels safe and supportive. The next step I'm going to talk through is listen. Before continuing with the video, I'd like you to pause it and consider the questions on this slide. What makes a good listener? And when answering this question, use the other two as prompts to help you. How do you know if someone's listening to you? And how does it feel when they're not listening? I'm now going to talk through some key points about being a good listener. Reflect on which of these match your answers and if there are any new ones for you to consider. When we're listening to someone, we want to practice active, non-judgmental listening. And we can do this by using appropriate eye contact. Acknowledge that some people struggle with eye contact, and it could actually make communicating with them harder if the eye contact is forced. Consider what feels appropriate. Positive body language. Have your arms unfolded, sitting or standing on a similar level to them, and facing them. Again, if this is appropriate for the person and the setting. Paraphrasing the information. Say some of the things they are saying back to them. This can help them to reflect on what they're saying and to clarify how they feel. No distractions. This means not using your phone and try to focus your attention solely on them. Ask open questions and allow silence. Silence can feel uncomfortable, but it gives that person space to think. Listening is a skill and takes practice. I would suggest you practice on normal everyday conversations and note how many times your mind wanders off or how many times you're thinking of your response rather than listening. Try to be non-judgmental with yourself. When you think you want to respond, try to put in a pause instead and allow them to continue speaking and see how you get on. Listening is so powerful as it allows a space for that person to express how they're feeling and to feel truly heard. Think about times when you felt upset and how much you didn't want to be given lots of advice, but rather space to talk. We have talked through notice and listen, and the next step I'll talk through is signpost. You are never responsible for someone else's mental health. Signposting someone who you're supporting is best for both you and the person you're supporting, as you're getting them to the right support sooner, whilst also looking after yourself. I'll now talk through some signposting options. There is a wide range of wellbeing support available from Student Services. I won't go into lots of detail here, but suggest following the link in the caption to find out more information. There are three main teams in Student Services, which are wellbeing, offering mental health and disability support, including therapy, learning enhancement, offering support with your studies, and student life, who support in most other aspects of student life. Within the service, there is support at lots of different levels of need. Sometimes we hear students say, "It's not that bad," or "Someone has it worse." Crucially, it's never too early to work on your well-being, and it's never too late to ask for help. You can support someone to reach out for support, as well as accessing support for yourself. It's important that person is ready to access support, but if you feel concerned about their safety, you can refer on behalf of that person. To access any of this support, all they need to do is fill in an online referral form, which can be found by searching Student Services Online Referral Form on MyUA portal, or following the link in the caption below. We also recognise that sometimes people aren't ready to reach out for support or would like to do learning for their wellbeing in their own time. Or maybe the times to access a service don't suit their timetable and needs. So we have a number of different support options and resources that are available to all UEA students, which I'll now briefly talk through. Student Services have a platform that all students can access via organisations on Blackboard. It includes a self-help and signposting resource for mental health and wellbeing, as well as diagnosed conditions and urgent support information. We have a UEA Wellbeing podcast and UEA Wellbeing YouTube channel. On the podcast, we have different wellbeing theme each month, and we break down that theme and chat about it in an accessible way with different people from the UEA community. And on the YouTube channel, we create videos which relate to the theme and other wellbeing topics and resources. Together All is a digital mental health service offering UEA students 24/7 support with trained clinicians online at all times. It includes a range of resources, peer support groups, and self-guided courses. Students can access career wellbeing support through Career Central. Career wellbeing is characterised by how optimistic you feel about your future potential, whether what you're currently doing is meaningful, has purpose, and is valuable to your future ambitions. Resources include events and workshops, one-to-one support, and self-guided learning. And lastly, for some of our students, their faith can play a key role in supporting their wellbeing. There is a multi-faith centre open to all UA students with a prayer room, which is available 24 hours a day once you're registered for campus card access. All of these are not instead of other support, but can enable someone to better help themselves and to understand when to reach out for support. There is also lots of support available outside of UEA. It's really important that if someone is struggling with their mental health, they make an appointment with their GP, as the GP can guide the student to access many other routes of support, as well as support in getting a mental health diagnosis and treatment. I'll now briefly mention some of the other support options available. Wellbeing Service, to access free counselling and group support and wellbeing activities. Mind, which has online resources and information about where to access support. Student Minds, it's a student mental health charity with online resources, and you can use their chat function or call for support. And The Mix, it has online support for up to 25-year-olds. It has resources in a wide range of issues and topics, and they also have a telephone support and crisis messenger service. This isn't exhaustive, but gives an idea of outside support options. You can follow the links in the caption below for more information. The next part of the video will be briefly talking through supporting someone in a high-risk situation, which includes self-harm and suicide. Please look after yourself. Pause the video or skip this section if that feels more helpful to you in this moment. It can be emotive when we have these conversations, so please go easy on yourself. It can help when talking through this if you hold something in your hands to help keep yourself grounded. It helps to communicate to your brain you're here in the present moment, especially when your mind wants to wander off into unhelpful thinking. This will be a brief overview about supporting someone where there is a high risk of self-harm or suicide. If you'd like training specifically on this, then please follow the link in the caption for Zero Suicide Alliance for an excellent piece of training on this. If someone is in a high-risk situation, then it's important to encourage them to seek professional help and encourage self-help and other support strategies. Allow space for them to talk about how they feel, but introduce some strategies to help them to feel more present and grounded in the moment, if and when possible. Ask them what has helped before, and who do they speak to when they feel like this. It's important to stay calm and listen to that person. Try to also use direct language. Saying the word suicide doesn't put the idea in their head. This can actually give someone space to talk about how they feel and feel validated. It's more reassuring than using vague language, which can be confusing for both of you. Ask them, do they have any plans to take their own life? And if yes, call 999 immediately. And if you are in any doubt at all about their safety, call 999. And as mentioned before, help yourself to feel more confident by taking part in further training, following the link in the caption below. The most important thing to know is that you are not responsible for someone else's mental health, and if in any doubt, call 999. If you're on campus, also call security. For urgent mental health help, it's 111 and option 2. And for a 24/7 free listening service, there's the Samaritans on 116 123. Supporting someone in a high-risk situation can feel like a huge weight to carry and can have a negative impact on your well-being. So next up, we're going to focus on self-care and the importance of looking after yourself when supporting someone else. As we spoke about at the start, looking after yourself runs across all elements when supporting a friend with their mental health. When we talk about looking after yourself, we're really talking about self-care. Self-care is the deliberate practice of taking action to improve our own physical and mental health. There's not one right or wrong way to do self-care. It's about finding ways that work for you. And rather than seeing it as a luxury, see it as an essential part of your daily routine that will put you in the best position to help yourself and support others. We have a whole playlist on our YouTube channel which talks through self-care in more detail, which you can access. Looking after yourself is fundamental when supporting others because helping people can be rewarding, but it can sometimes have a negative impact on our own mental health and well-being. Even if it's not a high-risk situation, it can be draining on our own resources when we're helping others. We also need to look after ourselves first before we can help others. Think about the oxygen mask analogy. Imagine you're on a plane and there's a dip in air pressure. You have to put on your own oxygen mask first before helping someone else. And this is the same for supporting a mate with their mental health. You need to be in a good headspace to be in a position to support them, as it can be draining. It helps to role model good self-care as well, as it can have this ripple effect. If people can see we're looking after ourselves, it can encourage them to do the same. And most importantly, using self-care helps you to understand your boundaries of how much you can help. You're not a counsellor or support worker, you're a friend or fellow UEA student. Boundaries protect you, but also them. It's not helpful for that person if they think, if I'm in distress, this is the person who'll help me, as it can make them reliant on you. By supporting alongside them, encouraging them to reach out for support and use self-help, you're enabling them to feel more empowered and more in control of their own mental health. Boundaried support helps to achieve this. Next, I'd like you to pause the video again and consider the following questions. What do you already do to practice self-care? Is there anything different you'd like to try, particularly in relation to supporting others? And can you pick a non-negotiable self-care action that you'll do no matter what? There's not a right or wrong, but try to really take the time to consider the actions that will best support you to support someone else. For the final part of the session, I'll ask you to consider a couple of different scenarios and what you would do, taking into consideration the points discussed so far. I'd encourage you to take the time to think them through for yourself first before continuing with the video. The first scenario is, someone on your course is quiet and withdrawn. Pause the video and consider what you might do under the different headings notice, listen, signpost, and look after yourself. There's not one right or wrong answer for these, but next I'll talk through some ideas under each of the different headings. Notice. You could say, "Hi, I've noticed that you seem quiet and withdrawn. Are you okay?" Be kind and curious and non-judgmental in how you approach the conversation. Listen. Ask them how they're feeling and actively listen to them. You could try finding out their likes and dislikes to understand them better and how you or someone else might be able to support them. Signpost. There's lots of different support options that could help a fellow student, such as Buddy SU, or their course advisor, or student services, depending on what the issue or difficulty is. Look after yourself. Consider how much time you have to give to this person. Do you have the time to help? Try to not take on responsibility for them and make sure you are clear about how much support you can give. Here's another scenario to reflect on. A friend discloses to you how poor their mental health is right now. Pause the video and think about what you would do under the headings notice, listen, signpost, and look after yourself. Again, I'll now talk through some ideas on these points. Notice. You could say, "You said that your mental health is poor, and I notice that you don't seem yourself." Pointing this out shows that you care, but make sure you're having this conversation at a time and place that is comfortable for your mate. Listen. Show empathy and validate how they're feeling. Thank them for sharing with you how they feel and be direct. If they are expressing low mood, ask them directly, "Are you having suicidal thoughts?" And if any doubt about their safety, call 999. Signpost. Contact student services if you're worried about them, and encourage them to contact student services themselves and their GP. Find out what makes them happy and encourage those activities. And also ask if they felt like this before, what's helped them, and could they apply any of those strategies now. Look after yourself. Be clear on boundaries with them about how much you can help. It can be useful to explain to someone, "I want to help you, and the best way for me to do this is to signpost you to other support, to professionals who are trained to help people who might be struggling with their mental health." As I said before, there's no one single right or wrong way to support someone, and I'm sure you'll have come up with some different ideas too, which is great. Although there are lots of different ways we can support someone, I'll now talk through some key points when supporting someone else, which can be used in most situations. Be supportive, sensitive, and non-judgmental, and listen. Remember active listening and that silence can be supportive. Be patient with them. They may not want to talk, and that's okay. Remind them that you're there. Do small things to show your care. That could be a cup of tea, a hug, sending a GIF or a meme. These things can often make a bigger difference than you might think. Encourage positive activities. Think of mentally healthy activities like going for a walk, going to the sports park, or cooking a meal together. Understand boundaries. You're not a professional and have your own mental health to maintain too. Consider how much you have to give and try to be clear about how much support you can offer. Signpost to other support. Talk about support at UEA and what's available and how to access it. This will help get someone to the right support sooner. Thanks so much for taking the time to work through this session. To recap, in this session we've explored practical steps to support friends and peers with their mental health. Hopefully you can now recall the importance of self-care when supporting others, identify ways to maintain or improve your own well-being, and identify the support available at UEA and how to access it. Further training and resources are in the caption. And take a moment now to consider anything you'll do differently when supporting someone having worked through this video. And thanks for watching.